75 degrees. It is feeling awesome out here tonight. It was kind of hot earlier this morning, 80, 85 degrees. I had to throw my air conditioners into my RV. I'm still recovering from having lithotripsy on Wednesday. It was a bad experience on Wednesday with the most nastiest and rudest nurses and doctor that I ever have to socialize with. I just can't stand my urologist. He's so cocky. He's just like, I get down there. Remind you, it's an hour and a half away from my home. Leave out early in the morning, get down there. I have to pee. I asked the nurse, does he need to have a urine sample? I don't see one on the chart. I don't think so. You could just use the bathroom. So I go use the bathroom. Okay. He comes in like 10 minutes later. Can you give me a urine sample? I'm like, I just asked the nurse if she needed a urine sample and she told me no. Well, I have to catheterize you or I'm not taking you in the back. I'm like, okay, whatever, cocky ass fucker. So he asked for a catheterization. They catheterized me, and this lady took out, like, no joke, like maybe this much urine, like not even enough, like this much urine, like, hello, this much urine. And I told her after she pulled it out, wait a second, because I really have to urinate really bad. And she's like, oh, it's just a sensation of the catheterization. I'm like, no, I've been catheterized plenty of times, and this is not a sensation. I really have to use the bathroom. So she's like, no, you don't have to use it, blah, blah, blah. I'm like, okay. So the one nurse gave me one of those call buttons, and you could call the nurse if you need assistance. I'm yelling behind the door. I'm like, hello, I need assistance. Hello. Anyone wants to help me? Hello. Patient in distress. So nobody came out to help me. I just got up on the bed and I peed all over the bed. Sorry, I'm hooked up to machines. I have blood clot things going on my legs. I got up and I peed on the bed. The doctor came in and said, what is this? I'm like, I told you I had to use the restroom. And he's like, get in here and clean this patient up and give her a new gurney so we could get going on her procedure. And where is her catheterization? I told you to catheterize her. I'm like, well, she catheterized me, but she only took out like maybe just enough for a urine sample. When I told her you wanted to leave the catheter in there, she told me, no, that's not what he wants. So he gets out. He's like, you know what? In fact, I don't want you back in that patient's room. She's already got issues, and I don't want to be having some issues with you. Okay, so I get a new nurse come in. They clean up the area. I tell the nurse again, I have to use the restroom. I think when they catheterized me, there was a kidney stone that was in my bladder. On the ultrasound, it said it was 3 millimeters wide in my bladder, and I think it was just blocking the passage of urination. So when she catheterized me, she literally pulled, maybe pushed the kidney stone up into an area where urine could flow. So now I told her again, I have to use the restroom. Like 20 minutes later, I need to use the restroom. Well, come to find out, the other nurse, when they gave me my IV fluids, she had the fluids wide open. So I'm getting a lot of fluid in me in a short period of time, which is now forcing me to use the restroom. So they arguing with me with the second time. So guess what happened? I got up and did it again. I don't care because you're pissing me off. I haven't had a cigarette. I haven't had my coffee. And I'm up early in the morning and I got to deal with nasty ass rude people. Attitudes are contagious. I could be nasty too. So I got up and peed again all over the bed. The doctor was pissed. Oh my God. He's like, what is wrong? I'm like, I guess when she catheterized me, she pushed that stone up into an area where I could now urinate because I was only dropping out this much urine. Not enough for a whole month. Okay. Now, the anesthesiologist comes in, and I'm telling her about my TMJ, that I have lockjaw syndrome on my right hand side of my mouth, and I can only open it so wide. I can't even get a toothbrush in there. Like, literally have to wash my mouth with like dental a jet thingy that gets in there, and you could clean your teeth and wash your in between your teeth and stuff like that. So I told her, I'm like, when you put me underneath anesthetic, if you have to put a scope in me, then please use a pediatric scope, because I have TMJ and you cannot stretch my mouth out, because you want to. Let me tell you something. I must have told this lady 3 different times that she is not going to stretch my mouth out when she puts me under. And she's telling me, well, I could give you medicine that could help you motivate your mouth to move open just a little bit. Now my whole entire jaw is like inflamed. I got a huge welt on my left side of my body, and it feels like a rug burn, like they drugged me. I got someone's nail print inside my elbow on the left side too. I'm gonna file a grievance, because this is bullshit. Every time I go to this hospital, there's something going on. I feel really great compared to all my last surgeries. I'm not having any issues. Just, feeling tired, obviously, because you just went through a lot of medications. And then on top of all that, just the pain of having the lithotripsy done. So I'm feeling really good. Did you get it? Did you get the buggy? She's a good protector. Miss Beautiful. She's a good protector. Yeah. That's my baby. Down. Girl, you gotta get down. That's my baby girl. She loves me. I've been trying to get her up in the car and trying to get her to trust me. I want her to trust me that I'm not going to dump her anywhere. I mean, she'll get in the car and she'll go for the ride, but when she sees the area I picked her up in, she will bug out, like severe anxiety. She's trying to jump out my car. She's trying to get out away from me. It's like something clicks in her head. What are you doing down here? Who let you out? Blue, get out of here. No. That's a horned dog right there. That's a horny dog. Yeah, no. Down. No need to get jealous. No. Down. See, she gets jealous when the other doggies come out. Especially Blue. And Blue gets jealous when I'm paying too much attention to someone else. Right, Blue? Why are you out of the house? You need to go home. Go home. Go home. I have to take Blue home. I love you. I love you, beautiful. You're my baby girl. Yes, you are. You're my baby girl, and I love you. Oh, I love her so much. I wish she could come in the house, but she has food aggression towards the other doggies. She got food aggression. And I'm trying to work on that. She's not food aggression towards humans. Food aggressions towards other doggies. You chasing him home? Are you chasing him home? Yeah, you chasing him home. Well, you got your doggy food. You got your water. Mama's going to go to sleep now. I'll see you in the morning. I'll see you in the morning. See you in the morning. Stop. Stop. No. Be nice. Be nice. Go home. Tell him to go home. Go home. Stop. 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 I love you, girl. Go night-night. Go home. Stop. You're going to stop. Stop it, girl. Come on, Blue. Go home. Go lay down in your housey. Yeah, now it gets really dark back here. You can see how I'm walking in complete darkness. And you couldn't even tell that somebody's even out here because you're in complete darkness. Over here, Blue. Blue is my protector. He's out here hunting and looking and searching and watching. And you can completely see how dark it is out here. It really is really dark. And I have to walk this. And I normally have my light on when I do walk this, but because I'm recording, I don't. Okay, y'all, so I hope everybody has a great night. Ciao.